Okay, welcome back. We've got some listener-submitted revision notes today, focusing specifically on parotid gland swelling.
Ah, yes. A classic presentation.
Exactly. And these notes look pretty comprehensive, so our mission, as always, is to dive in, unpack the key points, and maybe make them a bit more memorable for revision.
Sounds good. It's a topic where one symptom, that swelling, can point in so many different directions. Let's follow this structure in these notes.
Perfect. So starting with the absolute basics, definition. What are we actually talking about?
Well, simply put, it's just the enlargement of the parotid gland. The big salivary gland right there in front of the ear.
Right. And the notes highlight some key features. It can be just one side, unilateral, or sometimes both sides, bilateral.
Exactly. And often painful, right? Especially
Yeah.
the notes mentioned when eating or talking. Makes sense stimulating saliva flow.
Yeah, absolutely. And sometimes associated things like fever or maybe a nasty taste if there's an infection brewing.
Which brings us nicely to the causes, the etiology. Your notes break this down pretty well. You've got infections, obviously.
Uh-huh. Like viral things, mumps is the classic example listed for bilateral swelling, and bacterial infections too.
Right, bacterial parotitis. Then there are blockages, think salivary stones or sialoliths.
Okay.
Tumors are another big category. Could be benign. The notes mention pleomorphic adenomas specifically, which are quite common,
Ah, yes, I see that here.
or unfortunately malignant. And finally, autoimmune conditions like Sjögren syndrome are listed as a cause, often for chronic bilateral swelling.
And that distinction the notes make is really useful, isn't it? Between the bilateral causes, which often suggest something systemic,
Like mumps, sarcoidosis, Sjögren's, lymphoma, even alcoholic liver disease.
versus the unilateral causes, which are more likely something localized, like a stone, or that pleomorphic adenoma you mentioned, or just a one-sided infection.
Definitely a key clinical point to remember.
Mhm.
Thinking about who gets this. Any specific risk factors mentioned?
Well, for mumps, it's pretty clear. Being unvaccinated is the main one. For stones, things like dehydration, maybe poor oral hygiene, certain medications perhaps.
Yeah, things that might thicken saliva or reduce flow.
And the pathophysiology, why does it actually swell up?
It depends on the cause, naturally. Infections mean inflammation, so swelling from that. Blockages mean saliva backs up, kind of like a dam.
Right?
And tumors are, well, abnormal growth just taking up space. Different routes to the same physical sign.
So, clinically, what does someone actually experience? What are the key symptoms listed?
Obviously, the visible swelling, pain and tenderness are common.
Yeah.
Difficulty moving the jaw is mentioned too, opening the mouth, chewing.
Makes sense if it's pressing on things.
Yeah, sometimes dry mouth, maybe an altered taste. And fever, as we said, if it's infectious.
Okay, so you see the patient, they have these symptoms. How do you work out which cause it is? Investigations.
Starts with the basics, always. Good history, thorough physical examination. Then imaging is usually crucial.
Like ultrasound.
Ultrasound is often the first step, yeah. Good for stones, cysts, distinguishing solid from cystic. But CT or MRI might be needed for a better look, especially if you're thinking about a tumor or deeper infection.
It's sometimes you need tissue. Biopsy.
Sometimes, yes. Fine needle aspiration or even a formal biopsy, especially if there's any suspicion of malignancy.
Got it. And what else could it be? The differential diagnoses.
Good point. Need to rule out other things causing lumps. Notes mention submandibular gland swelling, lymph nodes being up lymphadenopathy.
Cysts. Other neck masses.
Exactly. So clinical picture plus imaging, and sometimes that biopsy helps sort it out.
What about how common this is? Epidemiology.
It really varies. Mumps, thankfully, much rarer now with the MMR vaccine. Incidence of stones or tumors depends more on age and other factors.
Okay, makes sense. So once you have a diagnosis, how do you manage it?
Totally depends on the cause. Viral stuff like mumps. Mostly supportive care rest, fluids, pain relief.
Bacterial infection.
Antibiotics are needed there. For blockages like stones, sometimes simple things work, gland massage, staying hydrated, things called sialodogs to boost saliva flow. Maybe helps flush it out.
Like sucking lemons. Though maybe not ideal advice.
Well, something sour, maybe. Tumors, especially benign ones like those pleomorphic adenomas, often need surgery. Autoimmune needs its own specific management.
And the outlook. Prognosis.
Again, various. Viral infections usually resolve well. Bacterial ones, too, with treatment. Chronic issues like Sjögren's or tumors. Well, the outlook is more variable. Depends on the specifics. But the notes rightly say timely diagnosis and treatment improve things. Definitely.
Lastly, complications. What can go wrong?
Infections can get worse, form an abscess or spread, causing cellulitis. You can get chronic or recurrent swelling. Surgery has risks nerve injury, particularly the facial nerve, which runs right through the gland.
Oh, right, that's a big one.
Yeah. Or a salivary fistula where saliva leaks out. And rarely the underlying cause could be malignant. So follow-up is important.
So wrapping this up for revision purposes, the real key from these notes seems to be understanding that parotid swelling isn't one diagnosis. It's a signpost.
Absolutely. A signpost pointing towards a really diverse range of potential underlying issues, from something relatively minor like a blocked duct right through to infections, autoimmune diseases, or even cancer.
Which really underlines, I think, just how vital that thorough clinical assessment and investigation process is in medicine. You can't just treat the symptoms superficially.
Precisely. You have to dig down to find the root cause.
A really important takeaway. Well, that's our deep dive into these notes on parotid gland swelling. We hope breaking it down like this helps it stick.
Hope it was useful for your revision.
And remember, for more structured revision help, you can always check out pastthemsra.com and freemsra.com. Thanks for joining us.